All right, good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. And today we're talking about pediatric concussion, some of the newest information on this issue and what it means to a child as well, or 18, 19-year-old, so to speak, which is technically not pediatric, but you know what I mean. Basically, somebody at the late phases of high school and what it means for them and their parents, and ways that we as a community, loved ones, and doctors can help these individuals better. Now we're doing this live on YouTube with a screen for those on Facebook. You can switch over to YouTube. If you can't catch it, we'll repost to YouTube. So let's see here. Okay, I love it. This is an article I really wanted to highlight. It's by Dr. Ellis. I believe it's out of Frontiers in Neurology. And Dr. Ellis is a neurosurgeon from Canada, and he's been doing a lot of research on concussions. And in his research, he's particularly looked at something that we as functional neurologists thoroughly investigate, which is vestibulo-ocular function, which is how your eyes move after a head injury. And good morning to everybody who's joining. Now, when we have a concussion, what is the standard recommendation that most of us know? People are told to go home and rest, basically wait out the symptoms. The symptoms should go away, and then through time, the symptoms go away. People can return back to their sports-related activities, and in doing so, they should be fine. They should be ready to start playing again. That's the situation for about 85 to 90% of individuals. However, it's not the case for that subset of 10 to 15% of folks who continue to have symptoms, who continue to not get better. And that group of post-concussion syndrome patients is really a key area of interest for a lot of doctors, because when individuals sustain concussion or sports-related concussion and they're not able to come out of it, it lots of times can severely and dramatically impact their life. So how do we identify who is going to develop post-concussion syndrome, and what can we do to rehab them faster, so to speak, get more targeted rehab, so to speak, to help these individuals? So that's what Dr. Ellis started looking at. And there's an overwhelming amount of information basically coming out saying, okay, this is how you need to assess a concussion, this is how you need to treat it. But from this article, I'll basically summarize what an individual needs to have done. So first of all, if your child has a head injury, the most important factor that has to be ruled out is, do they have a brain bleed? This is the reason for going to the emergency room and getting a CT scan in the acute phase of the issue. So you go to the emergency room, you see the ER doctor, they basically evaluate, are there signs of neurological dysfunction, and then they're going to decide on doing a CT scan. Lots of times individuals are told to go home and symptoms may persist, and they go back to the emergency room pleading for a CT scan. Usually at that point they get a CT and then everybody relaxes because there's no bleed. Yay, great, because we have to rule out life-threatening things for a concussion patient. So that makes sense on the whole. So the individual goes home and is told to rest, not go to school, not go to sports-related activities. And usually that's for about a period of 2 weeks. And in that time frame, we're looking to see, does that individual progress? Do they get better to where they can then go back to their normal activities relative to sports and daily life? So that's the standard. That's the first piece. Now, going deeper, we need to look at this in a little more up-to-date way. So certainly the first step is correct. We want to make sure there's no bleed. The second step, though, is we want to have a more thorough investigation of the injury. So this is where Dr. Ellis is saying, at this point, the individual needs to see somebody who's pretty astute and abreast in working with concussion patients. So you want to see a doctor who's going to say, okay, how were you hit? Show me video footage of how you were hit. Are you having cervical spine complaints? So is your neck stiff? Is your neck sore? These are really, really important things. Is your vision off? Are you having trouble concentrating? Are you dizzy? Are you having headaches? These symptoms are really, really important because there are 3 kind of components to why somebody is not rehabbing from a concussion fast enough, so to speak, so that they can maybe return to play a week sooner than they would have otherwise. And there are reasons why individuals, if you look at these three main variables, are going to develop post-concussion syndrome. So this table, and for those of you on Facebook, again, this is on YouTube Live and we'll repost to Facebook. This table, I think, represents the issue succinctly and accurately. As you see at the top, he says initial medical assessment. We have to have a clinical history. Why is the history important? It's important because if Johnny, for example, had pre-existing ADHD, or Johnny has a history of migraines, or Johnny has had concussions before, or Johnny had depression or anxiety before the head injury, those factors are really important because they're indicators that Johnny may be more apt to develop post-concussion syndrome. So history is super important. As I mentioned, the history of how did the head injury occur? Were you hit head on? Were you hit from the side? Was the neck rotated vigorously during the injury? Those things need to be assessed. Then a physical examination. And interestingly, when Dr. Ellis was talking about this, he says, you really need somebody who knows how to assess the cervical spine. And I would say physical therapists, chiropractors are very astute in that. Neurosurgeons, orthopedic surgeons are astute in that. But you need somebody to actually feel your neck and say, okay, does this hurt when I push here? Let's rotate your head. Do you have reduced range of motion? Do you have positive orthopedic tests, so to speak? So we push on your head and does your arm go numb? Things like that are very, very important in evaluating a concussion patient because the neck is oftentimes the forgotten piece, so to speak, for concussions. And then he says graded aerobic exercise testing. That's important because what we find with concussion patients is that they basically don't get blood to their brain in the appropriate capacity. So your brain is 2% of your body weight. It consumes 20% of the oxygen. 20% of the oxygen is consumed in your brain. Very metabolically active structure. So after concussion, what they find is that blood is not distributed appropriately to the brain in areas where it's needed. For example, the frontal lobes do not get adequate blood supply. Also, the brain cells have things called mitochondria, which metabolize oxygen. And lots of times the mitochondria are disrupted when we hit the head. So they're not able to make ATP, if you've heard of that, appropriately to get oxygen to the tissues. Or not oxygen to tissues, but to get the energy to the appropriate parts of the cell where it's needed. Also, something called POTS or hypotension is really common in concussion patients. So for our Facebook friends, down here at the base of the cerebellum, for our YouTube friends, down here at the base of the cerebellum, is where the brainstem connects into the cerebellum. And working with neuroradiologists, what has been found in my experience is that we're seeing a lot of the tension forces exposed to the brain affect the middle of the brain. They affect down here in the brainstem as well, and connecting structures between the cerebellum and the brainstem. That's important because your lower brainstem controls your blood pressure. So I cited a study, I think it was in 2019, I did a video where I talked about post-concussion syndrome patients, individuals who had a concussion and they did not recover. Basically, 2/3 of them had vascular dysregulation, meaning 1/3 had an issue where their blood pressure dropped and their heart rate went up when they stood up. The other third, their blood pressure dropped, but their heart rate was normal. That's really important because in both instances, you're not going to get enough blood flow to the brain. And there's something called neurovascular uncoupling, meaning I'm studying for a test, I'm using my frontal lobes and my hippocampus to try and learn information, and I don't get enough blood flow to those areas of my brain. That's a really, really big deal. That's called neurovascular uncoupling. So graded aerobic exercise testing is one of the key points that needs to be done in the acute concussion phase. And what happens is it's called the Buffalo Concussion Treadmill Test, if I remember correctly, also referred to as the Buffalo Treadmill Test. So the Buffalo Concussion Treadmill Test is where you put an individual on a treadmill, you're monitoring their heart rate, you're monitoring their saturation of oxygen, and you have them start walking and you have them start exercising, and you basically get them up to where they start to develop concussion-like symptoms. And at that point, you note their heart rate, and then you, in essence, take 80% of their heart rate, and then you try to exercise them in that capacity. One of the key things that Dr. Ellis argues is that we take patients who have a concussion, we take them out of activity, we put them in a dark room, we tell them to stay at home, and now they're getting deconditioned. Within a matter of days, the amount of muscle mass a person can lose is rather baffling. I think you lose like 3% of your muscle mass every 7 days, so to speak, that you're just resting, which is actually a significant amount. It's much harder to build muscle than it is to lose muscle. So now you're taking an athlete who's been training all year long or several months for their soccer event or their football games, and now you're deconditioning them, and then you're going to expect them, once their concussion symptoms go away, to jump right back in to activity and be completely normal. Well, that's not realistic. So that's where this is important. And so he says we need graded aerobic exercise testing. And then you see the second point is rule out more severe TBI, structural spine injury, and neurological medical conditions. So in essence, a really thorough neurological exam is what he's advocating, as well as an orthopedic exam of the cervical spine. If an individual has cervical spine dysfunction, he also argues that we need to be doing flexion extension, x-rays, or MRIs to assess, is there ligamentous damage to the neck? Very, very important. And determining the need for supplemental diagnostic testing. So you're saying neuropsychological testing, diagnostic imaging, and that's where I would argue once you get the CT scan or standard MRI and you know that there's not a bleed, you really want to look at more detailed neuroimaging, which I'll show you some slides of as we go down. Now on this slide, you see there are three primary components of the concussion investigation. Number one is vestibulo-ocular dysfunction, as you can see there. So as I'll point with the mouse cursor. Vestibulo-ocular dysfunction has been talked about for a while, but Dr. Ellis was one of the ones that brought it to the forefront, so to speak, because he did a study in 2015, I believe, and replicated in 2017, where he took a large group of concussed adolescent individuals. So these were pediatric patients who had concussions. I think there were 101 of them in the first study. And he said, okay, let's do vestibulo-ocular testing. What's vestibulo-ocular testing? It means your inner ear connecting to your eyes. And for those patients of Gates Brain Health, you know that we do video nystagmography testing. So we have this very expensive, elaborate equipment that monitors eye movements down to the millisecond. That's really, really important because your eye movements, if you look left to right, if you're following something smoothly going by, if you're watching a bunch of dots going by, tells us a lot about your brain function. And so he, in essence, found that if individuals had abnormal scores on that testing, or if they had symptom provocation along with the abnormal scores, that is indicative of vestibulo-ocular dysfunction. It's more detailed than that, but that's the basic gist of it. And so that's a really important piece, and it's a predictor of those who will develop post-concussion syndrome. So in essence, if you have signs of vestibulo-ocular dysfunction early after the injury, that's a predictor that you're going to develop post-concussion syndrome. And if you're a parent or a loved one, then you want to help that individual early on so that they don't develop post-concussion syndrome, because I don't know if you've known anybody with it, but it's not a fun thing to have. So then he says down from vestibulo-ocular dysfunction, you want to have targeted vestibular and vision therapy. Really, really, really important. And then the next bracket, so to speak, is autonomic dysfunction / exercise intolerance. So again, that's that Buffalo treadmill test, but it's also assessing individuals for hypotension as well as postural orthostatic tachycardia syndrome, referred to as POTS. Super, super, super duper important. And then he's saying create an individually tailored subsymptom threshold exercise program for that person. And you may want to bring in an exercise physiologist, physiotherapist, athletic therapist for that phase of training to say, okay, you know, you're a soccer player, you need to be able to run a lot, you need to be able to cut, you need to be able to, you know, kick and be really quick with all these activities. Well, let's create an exercise program that's going to be sports specific, but within your targeted heart rate range while you recover from your head injury. So that during this exercise program, we're actually recalculating and calibrating the heart with the brain to get more blood flow back up to the brain. So it's not as simple as just exercising. You have to create a sport-specific exercise program. And I would argue you want to merge your vestibular rehab with the autonomic rehab as well. So that's what we do in functional neurology, is we really try to get the brain and the vascular system working together again, because those circuits basically tie in with the lower brainstem and the cerebellum. And then he talks about cervical spine dysfunction, which again, as I've talked about in previous videos, your cervical spine is right down here, and it has direct connections from a sensory standpoint to your cerebellum and your brainstem. So that's really, really important as well. So that's the main gist of it, because, and there are a bunch of other figures here. This is the article I was talking about. I believe this was from 2015, but this might be the 2017 edition of it. Let me see here. Yeah. And going down, actually this is really interesting. So again, okay, so 77 patients. I think it was 101 patients to begin with, but they ruled out, 24 people for a variety of circumstances. So he saw in the post-concussion syndrome group that 52% of them had vestibulocular dysfunction. And those who had a short recovery after head injury, only 11% have vestibulocular dysfunction. So that was clinically significant. So that was what was important there. Okay, let me see here. Also, this is going through other important historical features. Again, previous concussions, previous migraines, previous post-concussion syndrome. Do you have amnesia after head injury? Did you have loss of consciousness? Loss of consciousness is a big area of argument in the concussion world. Do you need to have loss of consciousness to develop post-concussion syndrome? You do not, but a lot of people trying to argue that you didn't have a concussion are going to say that. And this is looking at diffusion tensor imaging, and I'm just going to scroll down to some of the colorful images here. So in essence, what they found as well is that diffusion tensor imaging, which looks at the white matter tracts of your brain, I would argue needs to be considered in any post-concussion syndrome patient, because we can really see, is there damage to the white matter tract here of the corpus callosum? We can also see damage to other areas connecting to the corpus callosum, and with new whole brain mindset DTI, you can see damage down here in the lower brainstem. So it's really cool, because this gives post-concussion syndrome patients an explanation lots of times that there is microscopic damage in their brain that is not being shown on your standard brain MRI. Because so many post-concussion syndrome patients feel dejected because they go to their doctor and they're like, well, your CT scan was normal and your MRI of your brain was normal, but just think that they didn't do the right brain MRI. It's so analogous to, like, you go in and you have whatever, you have your cholesterol tested, but they didn't do a detailed cholesterol analysis to see, the different components of your NMR lipid profile, like, different types of lipid particles, so to speak, to really discern what's going on. So you get the analogy. And these are images of diffusion tensor imaging and what's referred to as axial diffusivity, mean diffusivity, and fractional anisotropy, which is basically just how much water is around the nerves in your brain. So in summary, if you know someone with pediatric concussion, I would say a more proactive approach than just putting the person in bed and in a dark room is important. And I would also say you really want them to have a very thorough examination and evaluation by someone who's very abreast in concussion and dealing with brain injuries, as well as cervical spine injuries, as well as vestibulocular dysfunction, which is why functional neurologists are gaining ground, is having pretty good results with this issue, because most of them come from a chiropractic background. They have a neuroscience background as well, and much of their focus is on vestibular rehabilitation. So you bring those pieces in and you have someone who's quite ready to deal with something like sports-related concussion. So send me your questions, and I hope this was helpful, and we will be back soon with another broadcast, and I hope everybody stays safe and healthy out there. All right, thanks for watching, and we will see you soon.